Look at this split-screen illustration. On the left is a simple medical supply room, boxes on shelves, vulnerable to human error and decay. On the right, you have a highly structured clinical pharmacy. The difference between these two environments is a matter of life and death. That difference is governed by a strict operational code called Good Pharmacy Practice, or GPP. These are not loose suggestions or optional administrative guidelines. They are exact, non-negotiable standards required to safely dispense chemical compounds to patients. GPP exists for a specific reason: to promote the rational, effective use of medicines. By enforcing these standards, a healthcare system actively engineers safety into the process, accounting for medication errors, preventing adverse reactions, and minimizing inventory spoilage. Because the goods handled are biologically active chemicals, the facility functions as a rigorous quality management system to manage the high risks of dispensing. To understand how that system works, we will start with this blank architectural floor plan. We will visually construct a GPP-compliant pharmacy from first principles to see how these physical and operational layers work together to systematically reduce clinical error. By the end, you will see how good pharmacy practice serves as the foundational architectural blueprint required to bridge raw pharmacological science with actual patient safety. The first GPP requirement is the physical layout of the premises. The environment must be easily identifiable, perfectly neat, and crucially, accessible to disabled persons using wheelchairs. As you can see, our grid is now populating with distinct color-coded functional zones. You cannot have patients mixing with raw inventory. The space must be separated into dedicated areas: a waiting area, billing counter, and medicine storage zone, and, vital to the clinical process, a dedicated patient counseling area. Zooming in on that green counseling zone, you'll see specific furniture requirements dropping into place. This area requires tables, chairs, and a computer terminal to maintain comprehensive patient medication records, or PMRs. This zone also requires specific diagnostic equipment. A GPP-compliant pharmacy must stock basic healthcare tools like basic thermometers, sphygmomanometers to measure blood pressure, glucometers, reference materials, and demonstration charts. Using these tools, the pharmacist records baselines, checks for contraindications, and updates the patient's exact medical history during every encounter. By dedicating physical space and specific equipment to this process, the regulatory framework transforms the pharmacist-patient interaction into a formal clinical consultation. Now we pan over to the blue storage zone to build the second foundational layer: storage and inventory control. Here we install necessary cold chain refrigerators and heavy, secure lockboxes. Medicine is fragile. Active pharmaceutical ingredients degrade quickly if they aren't protected from light, dust, and humidity. GPP mandates precise temperature mapping and immaculate dust-free shelves to maintain the chemical integrity of the stock. Furthermore, highly regulated compounds like narcotics and psychotropic drugs must be strictly isolated. They are housed in specialized, locked cabinets and labeled according to strict legal regulations to prevent diversion and abuse. Inventory flow is strict. At the loading dock's quarantine node, incoming medicines are checked for quantity, batch, expiry, and packaging integrity. Compromised or expired stock triggers protocols. These goods are separated, labeled "not for sale," and routed away from dispensing for return or destruction. This entire inventory management system operates economically, but its primary goal is continuity of care. It ensures that critical healthcare products are always available in sufficient quantities when patients need them. By controlling the environment and strictly routing the flow of physical goods, the pharmacy creates an infrastructural failsafe against dispensing degraded or dangerous medicines. A perfectly engineered infrastructure requires qualified manpower to operate it effectively. This organizational chart overlay details the GPP manpower requirements. The entire facility must be managed under the strict supervision of a chief pharmacist holding a bachelor's or master's degree in pharmacy, who oversees assistant pharmacists possessing at least a diploma in pharmacy. These staff members operate under written guidelines. They are required to wear clean aprons and identification badges, and they must undergo periodic medical examinations and immunizations to ensure they do not introduce pathogens into the clinical environment. This qualified team executes the formal services layer of the pharmacy. That means adhering to clearly stated operation schedules,
offering managed services like home delivery, and providing specialized attention to elderly and high-risk patient groups. Finally, we activate the documentation layer. A digital network overlay shows data tying the physical space together, routing information from procurement to the dispensing counter. GPP mandates meticulous operational records. Licenses must remain visible, while purchase invoices, sales records, and patient profiles are logged relentlessly. Without this data layer, there is no traceability. If a batch of medicine is recalled, the documentation proves exactly when it arrived and exactly who received it. Documentation is the mechanism that ultimately guarantees quality assurance. When we zoom out, we can see the full isometric model operating as a single engineered unit. Watch how a prescription flows through this environment. The patient enters the accessible waiting area. The qualified pharmacist pulls the exact drug from a temperature-controlled shelf, verifies the batch integrity against the digital records, consults with the patient in the dedicated green zone using accurate health metrics, and hands over a perfectly viable medication. If you remove any single layer from this architecture, the system breaks down. A brilliant pharmacist cannot save a patient if the storage temperature degrades the drug. A perfect inventory system fails if there is no documentation to track a recall. When all these components interlock precisely, the system achieves the stated objectives of good pharmacy practice. Patient safety improves, treatment outcomes are enhanced, and patient trust in the healthcare system is secured. By replacing systemic chaos with strict environmental controls, dedicated specialized equipment, and rigorous operational documentation, a facility significantly reduces the likelihood of medication errors and adverse drug reactions. Ultimately, good pharmacy practice serves as the interlocking operational bridge that translates pharmacological science into optimal patient health.